In our healthcare space, we're all in the quest to achieve universal health coverage, the SDGs we're supposed to achieve, and so on. We have very, very ambitious goals, and we're very confident that we'll get into that trajectory. Our conversations currently linked to access, quality, equity, and then affordable healthcare for all. Key pillars linked to building robust healthcare systems include healthcare financing, it includes HRH, it includes infrastructure, purpose-built infrastructure, medical equipment, supply chain, technology as an enabler, public and private partnerships to do this together and move forward. So to that end, we are going to be introducing or expounding on an innovative approach that IFC and partners have taken on in addressing the pillar around medical equipment procurement and so on. So we welcome you today to engage and contribute and participate.
Of the project. So why did we design and start to implement AMEF? So basically, you know this better than I do, there's issues around medical equipment in the health sector here. And we saw a need for IFC to come in. And IFC, for those who don't know, we're part of the World Bank group. So there's the World Bank that everybody knows, that lends to governments, that provides advice to government. IFC, we work with the private sector. Hence, we have private sector players in this room. We invest in the private sector and we provide advice to the private sector. And in the case of AMEF, we've set up this financing facility and work with Co-op here. I'm very happy to see Co-op in this room with us today. Co-op is our partner in Kenya. We have a bank also in Côte d'Ivoire, Ivory Coast, where we started the program about the same time. So, what are we trying to do? We try to get more finance to what we call healthcare SMEs. We feel the bigger clinics are taken care of. We want to come in where what we call SME, small and medium enterprises in the health sector operate. They typically have less access to finance, harder access to finance, and we want to come in and work on their capacity to get access to finance, but at the same time, very important, work with Co-op to make sure they're having, that they're interested in the sector, see opportunities in the sector. So the program works both with Co-op on the one hand, with our OEM partners, distributors, and with the most important client, which is basically you in this room today. So as I mentioned, we work in a number of countries. Currently it's 9 where we're planning to operate. 5 in West Africa and 4 in this region here. Operations ongoing for about 1.5 years, I think, in Kenya. About the same time in Ivory Coast, but we hope to add more countries soon.
Nobody got into healthcare to make a profit, right? You guys all got into healthcare so you can help people, but you didn't want to make 1 cent. Right? I hear there's quiet. You can hear crickets now. No, we all got into healthcare to help people. I mean, when I went to school and they taught me medicine, I said, I want to help people. That's why I'm doing what I'm doing. That's why I got up at 3 o'clock in the morning to attend to babies, right? It wasn't off my own, I just want to do this for the fun of it. But something happened along the way. Somewhere along the way, some of us decided to go into business end of it, right? Some of us decided that just helping people, delivering babies or going to the OR, whatever it is that you did in your specialty was not enough. So we went to administration. And we didn't go into administration to make money because you could have made money a lot of different ways in this world without going into healthcare administration. It is not like oil, right? It's not. It's not like you're digging for gold. It's not like you're a CEO of some huge company. You're trying to work in your own geographical area with your own patient population, rising yourself from clinician to admin to be able to bring that hospital or that facility to the place where they can not only help patients, but stay profitable while they help patients, right? There's the problem. We're trying to do all these things, and in the midst of it, you have the fact that you need to actually get equipment to do this. Healthcare is tech heavy, right? Huh? Healthcare is tech heavy. It's actually more tech heavy than almost any other industry on the planet, because the problem with healthcare is it grows so quickly and it changes so rapidly, and you have to keep up to be what? Right, right? You have to keep up to healthcare. You have to.
Without diagnostics, medicine is blind. Let us not encourage blind medicine that tends to happen in many of our healthcare facilities. People give drugs without any testing. People just want to treat without confirming whether what they are treating makes sense or not. We know there are challenges, and that's why we're here to have the conversation. Let's engage.